I want to talk a little bit about the A study because the A study, Adverse Childhood Experience Study, is a very powerful tool that really came into existence through somewhat of an accident. And so this A study reveals that traumatic experiences during early childhood and adolescence is far more common than we previously expected. A man by the name of Vincent Felitti, he was the chief of Kaiser's Department of Preventive Medicine in San Diego going back to 1985. Dr. Felitti ran an obesity clinic where he helped people with their problems involving weight gain and issues like that. And he was very successful in helping people with this issue. But as he interviewed his patients and his database began to get larger and larger, he began to notice something that was very profound. And it was this, that many of his patients that experienced adverse childhood experiences, whether it was trauma or adverse or complex trauma, I should say, he began to make that connection between those experiences and obesity. So Dr. Felitti had the opportunity to present at a conference in which there were officials with the Center for Disease Control there. They had an opportunity to listen to his presentation concerning obesity and traumatic experiences. And they followed up with him, partnered with him, and began to do further research on the issue. And from this partnership came forth this questionnaire, this screening instrument called the A.C.E study. And so lots of facilities use it, lots of programs use this form, and it has been very helpful in regarding identifying those who have experienced this complex trauma and issues that have had profound effects on them, these issues that occurred early in life, and it's having an impact and effect on people in here and now. So as we begin to provide this instrument and have our clients complete it, we are gaining a tremendous amount of information. But what it helps us with is how can we intensify our services in regards to being more trauma responsive, or creating systems or programs that address the needs of those who are experiencing trauma. With this study, it promotes the idea of practitioners gaining more training and more research in regards to the impact of trauma and some appropriate interventions to address these issues. So I want to thank you for tuning in. And I want to encourage you to hit the subscribe button. And if you have any comments, feel free to leave your comments. So with that being said, thanks again. And I look forward to you tuning in to future modules.